So the question is, who pays for universal health care? The answer, we do, with our taxes. The employers do with their taxes, and the government makes up the rest of what's there. So we've done this a million times in video format. We're just going to talk about the UK style, and we're just going to kind of dumb it down to the most simplistic of terms. And I'm not saying dumb it down to imply that you're dumb. I'm saying to keep it simple for the sake of the video. I have a stepsister who lives in the UK. When they first moved over there and they came back here, they talked about how we were the laughing stock of the world. How they cannot fucking believe how our system of healthcare is run. And then in doing international travel, to the degree that my wife and I have done in the last several years, we've gotten to meet a ton of people from Canada, Germany, Italy, UK, various places throughout Europe, and they all just are in amazement at our healthcare system. So let's just take a look at it from the UK system. Grab a piece of paper and a pen, and I'm going to show you how this can be beneficial to you. Everybody, grab a piece of paper and a pen. On one side of that piece of paper, I want you to write down all of the following things. How much comes out of your paycheck every week for Social Security for the whole year? Social Security. How much comes out for Medicare? How much comes out for Medicaid? How much comes out for your health insurance premiums that you pay out of pocket to have your health insurance? In addition to that, put down everything that you pay out of pocket when you go to see a doctor, a specialist, buy your prescriptions, do any kind of tests or therapy that you have to do that you have to pay out of pocket, plus, anything that you may have paid out throughout the course of the year to take an ambulance to the emergency room, an emergency room visit, a hospital stay, whatever the case may be. That's obviously a little bit above and beyond for what the regular numbers are going to be. Social Security, Medicare, Medicaid, premiums, all out-of-pocket medical expenses. Put that on the left. On the right, put 10% of your gross pay. Before any of that shit comes out. 10% of your gross pay before any deductions. Imagine if you could pay for all of that with 10% of your gross pay instead of paying all of that. That's essentially what you have in places like the UK. You pay 10% of your gross pay. Your employer pays I forget what it is, 11 to 17% of your gross pay. And you get all your health insurance, all your health care taken care of, any medical procedures, any tests. In parts of the UK, you have to pay for your prescriptions, and it's the equivalent of like $10 a prescription, our money. And that also gives you a government-run pension, equivalent to our Social Security. So everything on the left, add it all up for the course of a year, add up 10% of your gross pay for the course of the year. Which one's smaller? And I'm just saying, when you think about it in Australia, I think it's like 2%. And the Australians and the Brits are going to come in and they're going to tell me a little bit more precise on the numbers. But that's what you're talking about. For 10% of your gross pay, you can do away with all of the Social Security deductions from your check, all of the Medicare deductions from your check, all of the Medicaid deductions from your check, because the healthcare is taken care of and you get a pension. So you don't have to worry about Social Security. You get a government pension, you get a national pension, plus all of that care covers your medical expenses should you need medical care in any foreign country, anywhere. You can get all of that without having to put out any of those. You hear about all the time from people. I see it in my comment sections all the time. I talk to people when I'm in Jamaica, when I'm in the islands from other countries, and they're like, "Oh yeah, I had a." Like for example, myself, a year and a half ago, I had to have an emergency. Was it a year and a half ago now? That was a fucking while ago. My gallbladder had to be taken out. Gallstone stuck out and pissed off my pancreas, and I was doubled over in the kitchen. Oh, I thought I was having a fucking grabber. It took me to the hospital. I was in there 4 days. You talk to people in other countries that have shit like that. Then, oh yeah, I had to have my gallbladder taken out. Yeah. Cost me $15 for parking. Why would we not want that? Does it not ring anybody's bell that countries that don't have universal health care are clamoring to get it, and every country that has universal health care is not clamoring to get private health care like we have? I mean, it works in every industrialized nation. I talk to people who live in these nations. I know people who live in these nations. It works for all of them. And then it comes down to the United States of America. And I'm not saying you are. You just asked a question. I'm talking to people in general now. It comes down to the United States of America. It's like, we can't get it done. So we're so star-spangled goddamn awesome that we can do everything on the planet better than everybody else, according to you fine folks, except run healthcare. Make it make sense. And a little postscript on this, if I could. When the initial conversation, or who pays for universal healthcare, for the most part we do. Just like we currently pay for our healthcare. We just pay too goddamn much for our healthcare. Your health insurance is a collective group of people within your state only. And it's not even your entire state, because there's a shitload of health insurance in your state. So it's a group of people within your state, and that gives you collective bargaining power, essentially, to bargain with doctors and hospitals and drug manufacturers for a better price, because a lot of people are coming in as customers in one time. Now imagine if your whole state could do that, instead of just a group of people in a state, how much power they would have. You know, if you're in Texas and you're part of one health insurance group out of fucking thousands of health insurance groups, but you did away with all those health insurance groups and you said the state of Texas is not going to negotiate for our healthcare. The power that you would have to do that. Now imagine the whole fucking country. Imagine us going to the healthcare providers and going, we're going to bring you every fucking person in the country as a customer. We want the best price possible. We will save money on our healthcare. We will not be stressed out because we might go broke because we had something major that we had to go to a hospital and get taken care of. People in this country aren't going to have to fucking decide between eating dinner or getting their fucking medication. And you're not going to be tied to your job because you need your goddamn healthcare, which is going to free you up to pursue entrepreneurial endeavors. I wanted to start that diner, but goddamn it, I can make enough money to survive off the diner, but I can't afford the goddamn insurance that I'm going to lose from losing my job, so I can't go start the fucking diner. Well, now you can't. If somebody came to me and said, we're going to make you president for one day, and you get to bypass Congress, you get to do whatever the fuck you want. One bill for one day in office. You need to enact one law with the stroke of a pen that's going to have the most positive impact on the most number of Americans across the board. It would be universal health care. That's what I would do. I would do universal health care without even thinking about it, because it would free everybody up to not be shackled to their jobs. It would give everybody coverage, no matter who they are. Everybody could finally go, I'm covered. I don't need to worry about it. And I'm spending less for my care, and I'm still getting the same great results. It's a no-brainer to me. This is the biggest no-brainer of all. Now, people will also come in and go, what happens to all those people in the private health insurance industry that would all of a sudden be out of a job? Well, a lot of them are going to have to figure out new careers. But a good chunk of them are going to get absorbed into the system that is going to need to still administer our health care. Some, not all. With this system, you would do away with a lot of the bureaucracy, and people wouldn't be making a profit off of our illness. In other words, we would no longer be just a liability to somebody if we got sick, which is what we are with our current health insurance companies. You get sick, all of a sudden you're a liability. Figure out a way to get them the fuck out of here as quickly as humanly possible. You're healthy and paying your dues, keep them paying those dues. Yeah, we like this relationship. You give us money every month, we don't got to give you shit. That's what we have now. That's what the conservatives in this country fight to protect. People making billions of dollars off of our illness.